From unsolved mysteries to unexplained phenomena, from comedy gold to relationship fails, Amazon Music's got the most ad-free top podcasts, included with Prime. Because the only thing that should interrupt your listening is, well, nothing. Download the Amazon Music app today.
This podcast is sponsored by Talkspace.
Last year, I went through many different life changes. I needed to take a pause and examine how I was feeling in the inside to better show up for the ones who need me to be my best version of myself.
When you're navigating life's changes, Talkspace can help. Talkspace is the #1 rated online therapy, bringing you professional support from licensed therapists and psychiatry providers that you can access anytime, anywhere.
Living a busy life, navigating a long-distance relationship, becoming a first-step father, Talkspace made all of those journeys possible. I could speak with my therapist in the office. I could speak with my therapist in the comfort of my home. I was never alone.
Talkspace works with most major insurers, and most insured members have a $0 copay. No insurance, no problem. Now get $80 off your first month with promo code SPACE80 when you go to Talkspace.com. Match with a licensed therapist today at Talkspace.com. Save $80 with code SPACE80 at Talkspace.com.
Welcome to IgAN Journey, the IgA Nephropathy Foundation's podcast. Here, we share information, tips, stories, and inspiration for living with IgAN. Using the power of our growing patient community, we are focused on funding research and building a network of support and ultimately finding a cure. To learn more about IgAN, to get involved, or help fuel our mission with financial support, visit IgAN.org. Welcome to our latest episode of IgAN Journey, the IgA Nephropathy Foundation's podcast. Compared with other chronic diseases, IgA nephropathy tends to strike at younger ages, which means many people are building their careers, raising families, or perhaps wanting to start one. And while pregnancy is an option for many women with IgAN, it definitely requires more advanced planning and closer monitoring to help assure the best outcomes for both mom and baby. Today, we are joined by Whitney Simmons, a nurse practitioner by training who also serves on our medical and scientific advisory board. Whitney also lives with IgAN. She was diagnosed in 2012 during her first semester of nursing school. Whitney had always dreamed of having a family of her own, so she's been down this path and now happily has 2 healthy boys, Ethan, who is 6, and Carter, who is 3. But her pregnancies weren't without their challenges. So she's here to share a little bit about her story, as well as tips to help other women with IgAN who are contemplating pregnancy and helping to navigate their journey and know better what to expect. But her pregnancies weren't without challenges. So she's here to share a little bit about her story, as well as tips to help other women with IgAN who are contemplating pregnancy navigate their journey and know more what to expect. Whitney, thanks so much for being with us today.
Thank you so much for having me.
So I'd imagine that a big part of your IgAN journey was trying to understand and really come to terms with how the condition would affect your desire to have children of your own. Can you share a little bit about that experience?
Absolutely. So my initial diagnosis was actually in 2012 when I was 23. I'd been with my husband for 4 years and we were planning to get married the next year. And then, of course, after that comes children. So the year before getting diagnosed, it kind of changed paths of things a little bit. So being diagnosed a few months later, we went and saw my OB/GYN just to kind of get a little bit of plans, because it's something new that you have to work around. It's something new that you have to modify. So just to kind of get an idea of what we were in for and what we needed to do. So kids, like I said, were always on our minds. When I got diagnosed, I was initially told that I would not have children, or there was a high likelihood that I would never have children. And that was almost the case. In 2014, I ended up with nephrotic syndrome. Whenever we were thinking about starting a family and thought that we were great, I really wasn't. And the nephrologist I was with at that time had said, you might need to go ahead and have kids now because you might not get the chance again. that would have definitely been detrimental to me and the unborn child because my kidneys were not in a great place and neither was my body. So I ended up switching nephrologists to someone that I actually worked with, and he had 20 plus years of experience. Immediately, he saw the need of high dose steroids and chemotherapy. So chemotherapy changes the game a little bit for wanting to have kids. And we were given a 1 month window to meet with a fertility specialist, see what we could do, harvest eggs, do something to where I would still have that chance, even if the chemotherapy was to infiltrate my kidneys and cause damage. But after that meeting, we found out that we definitely did not have the money for that, as I'm sure is the case with majority of people in the US, because we don't have that money sitting around when we're college students and newlyweds. So what we ended up doing is opting for a medication-induced menopause, and that would go on for the entire time of the chemo, which was 4 months. I was told that we wouldn't know if my ovaries were functioning or not until a year after trying and still not getting pregnant. So you still had that wonder and that uncertainty, especially whenever I didn't know anybody else with it. I know that's a feeling that majority of us have, and we didn't have anybody to go to at that time. But we were very blessed that 4 months after trying, we ended up getting my son, Ethan. And it was a struggle to get that initial pregnancy to actually be able to go in motion because of the follow up, the prepping. He wanted at least 18 months of stability. I was on cyclosporin, which is typically a big no for whenever you get pregnant, but we always have to modify and tweak things a little bit because what's good for me is not good for others. And what's good for one pregnancy isn't always good for the other pregnancy. So my cyclosporin levels were almost non existent, but I needed that little bit of a whiff to keep my kidneys going, which is good to have that prep time of 18 months or at least a year because we found out through trial and error what dosage worked well for me without putting too much harm to the fetus. And also getting off of extra medications like my ACE inhibitor and my statins, because those can cause birth defects before we even know we're pregnant. So that was the first journey with the first kid. After Ethan, we decided to try again. And I unfortunately had back to back ectopic pregnancies in 2019. And the first one was able to be aborted with medication. And the second one, I ended up having a ruptured fallopian tube and had to have it surgically removed. So it was a little bit of a rough start right there in the middle. And right after the second ectopic, we weren't even trying. It was not really a great time with having two back to back. And I guess the Lord knew what we needed because I found out shortly after that I got pregnant with Carter, who is my hot mess of a 3-year-old and will test every ability you have as a parent. So, and he's the one that was kind of the downfall of my kidneys. We've always been told that, I would have every pregnancy, I'll take a hit. So he told me I could get pregnant again, but just know that it may not be the best, as good as the first pregnancy. So definitely with Carter, the recovery of my kidneys is actually still going on 3 years later. So
I'm just trying to figure out how to follow that because that's a lot. I mean, I know I listened to you share this story before, and it's just, I'd imagine it was hard for you to keep your faith around.
I was going to say, if you ask the next one, that would definitely.
Yeah. Okay. So what helped you most during this period of time? Obviously, it sounds like there was a lot of uncertainty, but what helped you feel calmer and more empowered to be able to have the kids that you kind of had always dreamed of having with your husband?
There are two big influencers in that, and that is my husband and my faith. And that's what kept me grounded and kept me present and kept me going because Adam's always been there for me, helping me see the light at the end of the tunnel. With us, there's a lot of times where that light is gone and all you see is darkness. But you can't stop. You have to just keep moving forward because the only place you can go from there is up.
Yeah.
I don't ever want to say it can't get any worse because that'll come and bite you, but you can only go up from there. One big thing that I've learned is I never gave up my faith. That's definitely what's driven me of And I've never been a person that asks, why me? Why is this happening again? Because I've always learned that don't question the things that you don't know the outcome to, because we're being led in ways that we're unsure of. And I have faith that I will make it through. And my ups and downs and my failures and my triumphs with this disease have made me who I am today and have given me the life that I have. Because even though it's rough at times and it's kind of sucks, I wouldn't have it any other way.
Yeah, that's got to be hard. And I know when faced with challenges, right? I mean, it is an opportunity to grow as much as you question why. And you can very quickly go down that hole of why me, which of course, probably, for the most part, doesn't always end up being very productive. So it sounds like between your faith and your husband, you really sort of had a springboard to look at the positive, even if it was a very difficult time. I know for any pregnancy, even with people who don't have chronic medical conditions, it's really important to really actually plan before you have the pregnancy to make sure your body's in really good shape, and obviously a lot of vitamins and supplements on board. But it sounds like, especially for people with IgAN, early planning is essential. So both as somebody who is living with IgAN and been able to have two pregnancies, as well as your role as a nurse practitioner, what are some of the tips that you have for how women and their partners can prepare to get the best possible outcome for mom and baby?
I always use the word optimize. Optimize, optimize, optimize. So we want to get the body in the best shape possible to make the best outcomes possible. So starting those early conversations with your nephrologist on what your wants are and needs are for the future, starting the early conversations with your OB-GYN and making sure that they are speaking to each other. That is a big one, because trying to set realistic goals sometimes is a little bit rough, especially with each individual person and their wants and desires and needs. But if it can be honed in and made to each individual person, especially with the progression of their individual disease process, that will be something that'll be essential in a successful pregnancy, successful delivery, and then the after part of it. I think a lot of people forget about the after. And once they have the baby, they're like, great, baby's here, I'm done. But that's actually the part that I always let people know that you need to prep for, is because our body is going through so many changes that constant communication with your nephrologist is going to be key. Hormones, there's fluid changes, there's so many stressors on your body. There's another thing that I always tell people, and that's to remain positive but realistic. And know that it's not just you that's in this. It is, just like you said, it's your spouse, it's your husband, it's your wife, it's your kids that you may already have, and your family members. So this isn't ever going to be just a decision for you. It's going to be a decision that is a conjoined one for everybody, because it's just as much of your partner's future as it is yours, even though it is your body that is being utilized. So especially having those conversations with your loved one. Sometimes they might be closed door conversations just to totally understand where each of you are, but it's definitely key into the success of it.
So, I mean, they say when raising kids, right, it takes a village, but it sounds like for people who are living with chronic kidney disease like IgAN, you almost have to start your village earlier.
You do. And it's totally fine for a lot of people. They feel like they don't have a village because none of them are family, but you create your own village. And I live thousands and thousands of miles away from my family. So my little village that I've created here is loved ones and friends and some of my in-laws. It's literally what you make of it, and it doesn't have to be blood. So know
Yeah.
that you have that village and that support. Just because they're not family doesn't mean that they're not going to be there for you.
I think that I'm glad you're able to get that support system together.
Mhm.
So you've mentioned a couple times your OBGYN. Is this something that kind of a regular OBGYN is enough, or is this something that somebody should really seek out somebody with, who has expertise in high risk pregnancies?
I'm so glad you asked that. So whenever you are doing the pre-planning and you're optimizing your body, you're going to go through just your regular OBGYN, and they will see you throughout the entire pregnancy, and they're actually going to be the ones that do deliver your baby. But because we have chronic kidney disease, not just because of our autoimmune disease on top of that, but because of our chronic kidney disease, it places us in a higher risk category. So seeing a high risk OBGYN is something that everyone should do. It allows a secondary input, closer observation, and a few more options on top of your regular OB. And a lot of times they can give you those extra resources like checking the fetal heart rate more often or checking the ultrasound way more often. You get to see the baby, but that's because we need to make sure that fetal growth isn't being stunted. There's not anything that needs an early intervention. And just to prepare anybody out there, it is something that is going to be planned, because even if you have a natural birth or you attempt to have a natural birth, it's going to be something that's going to be planned, because a fetus is viable at 37 weeks. They are not viable. I'm sorry. They're viable way earlier, but they're considered full term at 37 weeks. So it is likely that they are going to push for you to have that baby at 37 weeks, because the longer that they're in the womb and inside of you where it can't be a controlled environment, the greater the risk is that things can happen. And for not very much more benefit to the baby, because they're already fully developed. The only thing that they're going to add on now is a little bit of pounds, some fat, storages, so that way it kind of helps them during that first week. But we can deal with that on the outside once they're here. So
Yeah.
if you're somebody who doesn't like medications or wants to do 100% natural, that's not really a pathway that is likely when you have IgA nephropathy. And home births are not something I would recommend with IgA nephropathy. Mine first one was at a level 2 neonatal center and a level 2 trauma center as well. It's where my nephrologist practices. But the second one I was able to do at our women's center, which is about 5 minutes away from the neonatal center. So just in case things happen. So we kind of have to look at things like that and plan ahead just in case things do happen.
Yeah. Well, and I'd imagine planning ahead like that gives you peace of mind too.
Oh, yes.
So you talked about kind of coming off of some of your medications, and I realize it might be different for everyone, and even, as you mentioned, between pregnancies. But in what ways does pregnancy really affect how IgAN is managed, and what should women be watching for? As we've talked about, they are at higher risk for problems.
Yeah. So there's a few medications that are kind of our staples with treating IgA nephropathy. And those ones can actually affect fetal development, like I said earlier, in the fourth gestational week of age, and before we even know that we're pregnant. So things like, of course, taking your folic acid, vitamins like that are essential, but getting off of those medications that are going to harm the fetus. And that's a very fine line that we walk sometimes with IgA nephropathy, because we may be on some medications that are known to cause fetal harm, but in small doses, but other ones are an absolute no-no. So one of the big things is that they're going to get you off of your ACE inhibitor or your ARB. A lot of times people are on like lisinopril or something to that nature. And two things that they usually go to is methyldopa and a beta blocker. So you might be on labetalol. And the big thing about that is our bodies respond to everything differently, all different medications. And you don't want to switch medications and then immediately get pregnant, because you need to allow yourself and your body time to adjust. Number one, the medication or the dosage they start you on is going to be lower and then kind of go up from there. We don't want you to be pregnant and have a hypertensive crisis, or be pregnant and completely drop your blood pressure to where the baby's not getting oxygen, because that would be the same as taking a clamp and just clamping it right off, clamping their oxygen off. So things like that are huge to prep. like I said, for the medications that we are normally on. One medication that is kind of up in the air is Farxiga. It's one that's a newer one. It is a very good medicine, but I'm unsure of what most nephrologists are doing. In the end, it's risk versus benefit. So if there is a huge benefit with a mild risk, then it's likely you're still going to stay on it. The other things is your immunosuppression. So number one, prednisone is not recommended in the first trimester of pregnancy. If you need to be on it later on, that's fine. But first trimester of pregnancy is an absolute no-go during those very key and vital fetal development. And like I said, I was personally on cyclosporin. There is many medications that are out there. There's Imurin, there's Cellcept, there's Tacro that many people have pregnancies while being on, whether they've got an autoimmune disease or if they've got a transplant. But they need to be monitored and managed to the, again, most optimal level, the most benefit with the least amount of drug. So those are very vital things that have to happen. And like I said, those early conversations is what will kind of disseminate your path with those medicines.
So what's your advice for women whose IgA nephropathy is either very advanced or who just are really scared of the potential risks?
Be your best advocate, knowing what your true, again, risk versus benefit. I'm a broken record sometimes, but it's kind of what you have to do. Because if you're an end stage renal failure, but you've been in that point of it or at that level for 10 years, your risk of declining is a little bit less than somebody who has had a rapid decline over the last year or two. So you have to weigh each individual person's risk and benefit. And those are conversations that you can have with your nephrologist and see, again, what is perfect and what fits the picture for you and your progression of the disease. Because all of us know we may have the same disease, but we all respond differently to medications. We respond differently to symptoms. We progress at very different rates. And sometimes there is no rhyme or reason to how you're going to progress. You can do everything right and it still will happen. So don't lose your faith in being a parent. Don't lose your faith in the sight of having that joy and that happiness in your life, because sometimes the plan may not be for you to have a natural baby and not to have not to birth a child. The plan may be that God sent you this wonderful little boy to adopt. So everybody's path is going to look differently. And especially those early conversations with your loved one is going to be key. I was almost brought to tears the moment that my husband told me that he was perfectly fine with adoption because he'd never actually wanted to adopt before. He just wanted kids. And as my disease process progressed, it's something that we were just randomly talking and he said, well, of course I'm fine with that. I'd be happy to, raise a child that we've adopted. So it was such a game changer for the way that you feel, for the way that you approach things, because it's no longer the end of the world or you don't feel like a failure because you can't have a baby. You can still have, again, a happy, healthy life and still be a mom. So just knowing what your individual path is going to be is key. And realistically speaking, there's a lot of people that won't be able to, because you need to be alive and well and be able to have those moments with your kids. And if you push the limits just because you have to have a baby, unfortunately, it may not play well in a favor. So, like I said, just know what your overall goal is and know that you can reach that without having to give birth.
Yeah, and they can lean heavily on experts who can advise them as to whether it's too risky as well.
Oh, absolutely. And I would take advice in stride. And because, like I said, everybody's going to be different and you can take advice, but please speak with your doctor about it first. And again, be your best advocate. If you feel like something's missing from your care, then reach out to an advocate. You can always reach out to the foundation or myself, and we can always speak to some specialists that we know in the area and see if what you're being told or what is kind of going on with you and the care is actually par for the course. So it's not something that you want to particularly take advice set in stone from Google or Facebook or something like that, because again, it's not individualistic.
Right. Well, and I know, as you know, you're not only on our medical and scientific advisory board, but obviously an ambassador too, and you've kind of gone above and beyond in terms of sharing your story and making sure that other young women who want to have a family feel empowered. And as you mentioned, I mean, pregnancy is possible for many women with IgA nephropathy, but it comes with its challenges, and it might not be the right choice for some people depending on how advanced their disease is. And I know you as a mom, and you're super involved in your kids' life, coaching basketball, and you can share with us other ways in which you're involved in your son's lives. But I'm sure it can be exhausting for you sometimes, especially as there are definitely good days and not so great days with IgAN. How do you make sure you're taking care of yourself for any new moms out there?
I always say, do as I say and not as I do. Because even though I have IgAN, I'm a mom, I'm a wife, I'm a provider. It's a lot of factors that go into it. And sometimes you're just going to be tired. Ethan does karate and kickboxing and jujitsu, Monday through Thursday if he doesn't have baseball practice or baseball games. And then he has basketball, and then he has football. And you want to be there for every moment of your child's life. But sometimes you just kind of have to rely on your village. I rely heavily on my stepmom and my husband, and have them kind of help you take the reins. There's points that I have to go home and take a little power nap while the kids are sitting there like rolling around me for just about 5 minutes, and then I'm good to go. So you just kind of make little modifications, because there's only some things you can control. I can control what I eat. I can eat better to try to help my disease process. I can do my best to avoid some things, like I don't smoke. I don't do any type of illicit drugs. I try my best now, especially being on a certain medicine, to only have a drink every now and then to not affect my liver. So those are things that I can control.
Yeah.
But sleep isn't really something that I can control nowadays,
Yeah.
especially, you have young kids and they want to crawl in bed, or you have the dog. And then also you have the disease process itself, where you just sit there and you have absolutely no reason why you're awake, but you're awake. So it gets busy. You do have to take care of yourself. And I still do my best to put my kids and my husband first. And I do have to say it will wear on you. So like I said, find your good support system, and don't be afraid to rely on them. Don't be afraid to ask for help, because it's not something that you're going to be able to keep up with.
Yeah. That's good advice. I mean, I hear you saying basically no one to say no, right? No one to kind of take a
Yeah,
break for yourself, and then surround yourself by people who show up, whether it's family, friends, they'll be there for you to share the load, and kids benefit from having other adults in their lives who care about them as well.
absolutely.
So this is such a personal and intimate topic. Is there anything else you'd like to share about kind of living with IgA nephropathy and pregnancy?
It is terrifying initially, especially during your first pregnancy and in that first trimester. And honestly, up until viability around 21, 23 weeks. And we already have this high anxiety, some depression with having a chronic disease process. And then we kind of add this on top of it. So make sure that you take care of your mental well being along with your physical well being, and check in with your partner. They're going through it just the same as we are. And usually there are there are everything, but making sure that they have someone too. If it's not you to go to, make sure that they have somebody they can go to and seek out help and just need that helping hand or that shoulder to cry on, or, because they're concerned right there with you. Like I said, it's not just you that's going through this. So that fear and anxiety can definitely start to be minimized if you just do it together. And personally, up until that 21st week, I couldn't breathe. I just was worried. But then you have to kind of have a little heart to heart with yourself and say, this anxiety that I'm having, this fear is keeping me from enjoying something that I've wanted for a long time. So you want to enjoy your pregnancy. You want to not stress your baby out. So it's okay to worry, but don't let it encapsulate your life. I personally loved being pregnant. My first trimester, I was sicker than a dog. Second trimester was beautiful. And the third one, I couldn't hardly walk. I had a waddle. So they all have their struggles, but I loved it. And it's just, like I said, it's just something that make sure you have your person there and make sure your person has a person. There's some more things that I always encourage people to talk to their doctor about, and that is enhanced monitoring. Even if it's not your high risk doctor, talk to your nephrologist, because things that will help alleviate as well some of that fear and anxiety is having that constant observation and monitoring, especially knowing that we can change so rapidly. It will help. So I always recommend people to have their labs drawn monthly for the first trimester, every 2 weeks for the second trimester. And since things can change so rapidly in the third trimester, I recommend weekly. And that is definitely with taking your blood pressure, which I recommend for everybody who's on blood pressure medicines or has kidney disease. Take your blood pressure once a day. It doesn't have to be the same time of the day. Take it today in the morning, tomorrow in the afternoon, the next day in the evening, and keep a log, because that might be able to show trends over time that you're starting to go up and that they may need to increase medicine or decrease it. So again, that can help to alleviate some of that fear and anxiety. And then also knowing when to seek out help. That is something that needs to be asked early on from all of your providers, your high risk doctor, your OBGYN, and your nephrologist. They may all have different concerns. So we need to know what those concerns are for each doctor. And don't be afraid to sit there and write things down or ask them to repeat it, or ask them to repeat it in something that you understand. So they're there for you.
You're helping us with some tools that we're going to launch that will help women kind of think about these pre-pregnancy considerations. Also, as you said, so much is kind of post-pregnancy too, right? So it's like, what about my kidneys now that I've had a baby? So we will, as a foundation, also have those tools available to kind of help guide these conversations and help women and their partners really kind of advocate for themselves.
Know that I'm always here for you guys too. If anybody needs to have somebody there at their appointment with them, anything like that, I can't physically be there with you, but just know that you can always touch base with me and we can coordinate, and I can be there with you over speaker or video or something like that to kind of help guide you and kind of relay the information that the provider is giving you. And also, if any doctors or physicians that are part of your care would like to have a talk, I'm perfectly happy to help out with that. Anything that we can do to make everything as best as it can be for you and as smooth as it can be for you. So
That's such a kind offer. And obviously, the whole goal is obviously to make sure that the mom and the baby have the best possible outcome. So that's so really kind of you to be that resource for women. What's the one thing you'd want them to take away from our conversation today?
Oh, well, one of the biggest things that I've always been keen on is being your best advocate. I can't say that enough. And you are the voice, and so is your spouse of that unborn child. So don't be afraid to ask questions. We need you to ask questions. And if something doesn't seem right, again, reach out to the foundation or reach out to another part of your healthcare team and kind of go over that with them. And of course, another big takeaway is we're not all going to have the same pregnancy. We're not all going to have the same outcome. And our families are always going to look very different. But a family is what you make of it. And your family is there for you, whether you've birthed it or you've adopted or you are a foster parent. Your family is your family and your children are your children. So don't ever get discouraged or feel like you're not a mom. You're not alone. I mean, that's our biggest thing here at the foundation.
I think what you say about whatever path somebody ends up on to have a baby, whether it's their own biological child or an adopted child, their family is their family. And I think that's really great advice. And you talked about kind of how our mantra is really no one's alone. You're not alone in this. And certainly speaking of family, Carter and Ethan have become VIPs.
Oh my gosh.
Right?
Nobody cares about how I'm doing. It's just how's Ethan and Carter, you know?
Everyone cares about you. But I mean, what a resource you've been. And we hope our listeners get a lot out of this episode that talks about kind of what you can think about in terms of pregnancy planning. I appreciate you being with us today and also offering your support to so many women.
Absolutely. Thank you so much for having me.
All right, well, take care. Thank you for joining IgAN Journey, the IgA Nephropathy Foundation's podcast. Here we share information, practical tips, stories, and inspiration for living with IgAN. Everyone's at a different point in their IgAN journey, but we're here for you. You're not alone. To learn more about IgAN, to get involved, or help fuel our mission with financial support, visit www.igan.org. The information and opinions shared in IgAN Journey are not intended to serve as or replace medical advice. Always speak with your nephrology care team about treatments that are right for you.